Oh,
Yeah, boy.
yeah.
Alrighty, gents. Here we go.
Y'all just sound like old men when you come in the studio, though.
Oh man,
Oh,
You
here,
you hear my
Andre.
chair squeaking?
hi everybody. How are we doing? Welcome to another edition of the Living Room. I hope everyone is having a fantastic Sunday. Here in the UK, it is unbelievably hot.
Yeah.
I know, y'all gonna tell me don't complain. I won't complain. But anyway, thank you once again for joining us here in the living room. As usual, it's me, Andre, good friends Mark and Philip, and we're just gonna have a conversation. So let's get started. How we doing, guys?
Cooking.
Cooking.
Absolutely cooking.
Yeah.
Yep. Yeah, it's been quite a hot day, man. I sweltering a little bit under the lights tonight, but doing good, man. Feeling good. Yourself?
I
What you
doing
doing,
good. I've
Phil?
been out in the sun. I've been out in the sun all weekend
Really?
playing cricket. Yeah.
You were playing cricket or you were at cricket?
You mean you the throwing a
Playing.
ball?
You ever play cricket against me, Mark? Honestly.
Yeah.
For
So
all the years I know this man, the only thing he's played is volleyball.
this is breaking news, B.
With football, he's like two left feet. But he might see play cricket.
All right, go ahead, Phil. Convince
Football
me.
with
Go
a
ahead.
no man. I'm a little bit of a off spinner.
I had a
Off
feeling so.
spinner.
He's
Yeah.
an off spinner for a slip man.
Yeah, exactly. I was just spending time with Miles. Miles has been getting into cricket quite a bit. Miles is my son for the others, so it was his birthday.
Oh wow.
Got him a cricket
That's
bat,
true. Okay.
and yeah, he's been keen on just getting some batting in and some bowling.
So you got into it.
Yeah, man.
You're getting it to turn though.
Preparing him for the West Indies
All right, all right.
You're getting the ball to turn.
every now and then.
I have never heard this man talk about playing cricket. But anyway, now I understand who he playing against anyhow.
Yeah. Mock cricket.
I know my limits. I know my
He
limits.
about there pelting, talking about spin.
The next time we get together, we can get the cricket bats out.
Good.
All right,
Good.
I
Good.
with you. I with
Good.
you. Let me get out the bats, man.
So long handle will be on.
No swiping either.
This
man.
sweet. Oh, genuine cricket shots is what you're saying?
That's what I do.
Wow.
Alright.
Wow. I'm impressed though, I have to say. I hope Miles had a good day as well.
Me
He
too.
did, man.
Fantastic.
No problem. I hope they got some footage of that so we can put that in the group one time. Just to see if you actually can play.
Okay, next time we'll get some footage.
All right, no problem, no problem at all.
Wow.
Anyway, guys, how things, man? Because lots of stuff going on here and going on in the Caribbean too. Where you want to start?
Man, it's been a busy week. It's been a busy week just trying to keep on top of what's coming out of the Caribbean this week has been phenomenal. But here in the UK, a couple more lockdowns. Phil, you escape yours because you're playing cricket, so clearly, things are okay up in the north. But I
Well,
see
the
a few other
message,
places are getting a little bit of a stranglehold put around them.
yeah, parts of Manchester we're still okay. We haven't gone into where I live. We haven't gone into complete lockdown, but the
Yeah.
messages are still a little bit mixed, to be honest. So in our area, you still can't have people over to your house. You can't have them in your
Right.
garden, but those same people and others you can meet in the park
Man,
or in a local pub.
go and have a drink, eat
Yeah.
out to help out. You got to tell you so every week?
But you can't get them at your home.
No,
No,
we're going to eat out.
All right.
exactly. So you see, that's the theory that this is actually, let's see how we can ensure that we can get some money back into the economy.
Yeah, man.
It's not
Yeah,
so
man.
much about
So you
health.
think it's economy over health then?
Yes.
I think it is right now.
The health thing is just the noise, but the real thing is just like, well, we want to keep the economy going, you think?
Exactly.
I think I agree with you there too.
I think, yeah, I still think there's a health concern as part of it, but there in everything it's all about where do we want to take the risk.
Yeah.
I agree. I think it's a risk thing. I think governments around the world are just getting to a point where we're going, okay, we got to figure out how we live with this thing.
Yeah.
Yeah,
Let's hope we've learned our lessons from the initial wave, so therefore, hopefully, the health services won't be overwhelmed on what's not has happened in different places.
Yeah.
But let's ease ourselves back into some kind of normality. it
Yeah.
seems like that's the way how everyone's
Yeah.
going with it.
Absolutely. Yeah.
But over in the Caribbean, last Tuesday I saw the arrival of Inter-Caribbean into the Eastern Caribbean, which I thought was a really important moment. We've
Yeah.
talked so much about interregional travel on this show, and it's awesome to see that we now have a carrier with the ability to really make interregional travel a reality, and promising a cost that will be attractive. So I think this is good to see.
No, I agree. I mean, as much as I have an affinity to Liat, as I think many people do in the Eastern Caribbean, we got to move on. The conversation got to move on. If Liat can get the act together and come back and be viable, that's great. But we got to move on and get into regional travel up and running again. So I think that's something we just got to focus on and just keep looking ahead.
Yeah, I was really keen to see that.
Yeah.
Yeah,
And
and if they can fill the void, that'd be
Then it's
great.
good. Yeah.
yeah, and I think people are really keen to move again, and the Caribbean is a really good place for us to try and get together and enjoy ourselves. I also took note, and I don't know if you guys saw, the passing of Jerry S. George, which was really, really sad. A icon, not just in the OECS, but across the Caribbean. And I felt that, this was a real sad moment. We take it for granted. Sometimes we can sit on broadcast and not even realize how easy it is sometimes for our friends and our colleagues to have a moment. And
Yeah.
Jerry was doing a great job over there in St. Vincent.
Yeah, I think this was an interesting one for me because I know the name, but I didn't realize how much he was also doing online and that kind of stuff until
Yeah.
actually the day he passed. Actually, and I went back and saw his catalog, and he actually has some fantastic shows online. For
sure.
Actually, just looking at news around the Caribbean, waking up very early and doing some great things. So yeah, it's a sad loss for the region, I think.
Yeah.
So yeah, definitely a sad loss. Also, what we got going on is tomorrow or come Tuesday,
Yes.
Trinidad could be waking up to either the new or the same.
Yes,
so
yes,
it's
yes.
interesting to see how this is going to be going.
The UNC is saying that was the time, and it would seem that Prime Minister Rowley was listening to Curtis Jordan last Sunday in the living room, because I see a lot of the requests that Curtis was making have appeared in the manifesto. So
I noticed too.
unless
Yeah.
Curtis was reading the manifesto before he came on the show.
Or did
Well.
Curtis write the manifesto?
Ooh.
Well.
On that guy,
Did he have input into that? It sounded like
That's what
that
I wondered.
actually.
Yeah, man. Yeah, so that
No, I
was-
think this is going to be pretty interesting. It's also going to be interesting to see how his handling of this, coronavirus period and season plays into how people view his, his premiership. Because I know the way how he may have handled people coming back or repatriating Trinidadians back into the country didn't go down well with many, but it
Yeah.
also went down well with many. So
Yes.
it'll be interesting to see what happens there as well. That's going to be an
Absolutely.
interesting election.
And south of that, Dr. Mohammed Irfan Ali was sworn in on Friday, and I did not even realize he was only 40 years old.
Yeah.
This was a real surprise to me. A young man taking on one of the what is in my view one of the powerhouses of the Caribbean, and about to go off on a real big area in terms of oil revenues
Yeah.
for Guyana.
Yeah, I was going to say, beyond being a powerhouse, it's a season in Guyana's history that will be remembered, no matter what, because of what's happening here now with the oil, how they manage it, how they get it out the ground, how they use it, infrastructure development. It's a real pivotal point and season for Guyana at the moment. So he's taking over as young as he is at a time when, Guyana is at a place of a crossroads as to where does it go? How is it managed? And I think everyone would be looking at Guyana because in the past, it could be accused of not necessarily managing everything well, various prime ministers and presidents. So this would be an interesting time. I think all eyes are going to be on him.
Well, he's promised
Yes, I mean,
a
it's a
forensic
good-
probe. Sorry, go ahead, Phil.
No, I was just saying it. We can say it's a fantastic time or interesting time for Guyana, but maybe also for the region as well.
Yeah.
It is a pivotal time for us to be looking at Guyana and looking at how trade and investment in Guyana within the region could also be afforded, and how he might influence that in his premiership.
Yeah.
For sure.
So
And
it's
I don't
interesting times.
know. One other thing that caught my eye was, Jamaica, and they're starting to talk about some elections now, and the PMP is promising a referendum. you know, you got to get nervous sometimes when you hear this word, but they're promising a referendum within the first 18 months after they win the next election on whether or not the Queen should stay as the head of state of Jamaica. So that's an interesting one as well to keep an eye on.
I think that's going to be coming right across the region after the junction of, the whole Black Lives Matter, a bit more
Yeah.
consciousness. Don't know if you saw the lecture, the Emmy Bryan lecture by Hilary
Hillary
Beckles
Beckles?
last night. That was fantastic. But I think coming out of that, there's going to be a lot more awareness of going, who are we? Where are we going? How are we going to get there? What are
Yeah.
the things, the people, the historical events that we want to
Yeah.
keep hold of, and where do we want to chart our own course. So I think it's going to be an interesting time for the entire region, actually. So I'm not surprised at
Absolutely.
that.
Absolutely.
And
Absolutely.
I think if Jamaica does that, it will have a domino effect across the region, given the influence of Jamaica as well.
On the region. Yeah, that's true.
And there's just one other thing that I really angered me this week more than anything else. You saw this thing about the US travel advisory about talking about a risk to US visitors and travelers to the what was this about? The US living in the real world?
Philip, I will let you go first, because how you respond might help me measure my response.
Phil Temple is Maya.
I think like any other nation, the US looks at, is it nation before the rest, or are we an international part of the international community? I think at this time their leadership is really going along the lines of be a national first.
Now what leadership?
Man,
In the
I
leadership
don't
in the
even
US,
know.
what leadership what?
I suppose, to be fair to Philip, de facto there is leadership. Whether or not it is leadership,
There is.
There might be a
leadership.
name for it, but I'm not sure it's leadership. But anyway, carry on.
Exactly. But see, that's why it's got to get Philip answer these
You can
things
call
first
it. You
before
can
we-
call it another name.
Yes.
You can say he is there influencing policy, but an influence in the culture and mood of society. But that is what leadership is.
I'm sure we'll come on to it a little bit later on, but all I would say is that it's embarrassing. That is completely embarrassing. But that's it.
Anyhow, so listen, who we got in the living room this week, man?
Today's one of them days, sometimes you hold a party and you're not too sure how many people come in, and then everybody you ask come, and you go like, but we can't have this thing without this person, and we need everybody.
So,
Today we got a house full of people. That's the only way. That's the only way I can say. House full of people here. So let me go down the list here. So we got Dr. Pauline Morris, who's a Bajan in Qatar. We hopefully later on we will have Dr. Brennan from the Bahamas as well. Shannon Niles, who's incidentally my cousin as well, who's a nurse in Boston. We have as well Alicia Baptiste, who is a nurse in St. Lucia. We have Shayna Burrows, a Bajan epidemiologist who's based in Boston. We have Stephanie, who is a Trini Bajan in Florida, and we know what's happening in Fort Lauderdale in Florida at the moment. And then we also have, I'll call her Nurse Patton at the moment, or Panton rather, who's a Jamaican here in the UK. So we got a full house. And I think when we're talking about health, and not just talking about health, but one of the things that we notice right around the world is how healthcare workers have been celebrated, even right here in the UK and what's not as well. And it's important for our people to know that not just healthcare workers at home, but the West Indies is well represented right across the world in this area, helping to combat, helping to make people better, and just they're at the forefront of it and on the front end as well. So I thought it would be great if we highlight some of those people, see what they're up to, how they're coping, and even later on as well have a discussion of looking ahead and maybe where the region goes from here as well. So it's going to be a good discussion.
No, that is awesome, man. I know we've been bringing people at the side door for the last couple of episodes. You can bring this through the front this week.
I can bring in everybody, man.
Got open both doors too.
You got open both doors so the win can come true, because this is a big conversation this is, but rightfully so, and you're absolutely correct. Our Caribbean brothers and sisters in health have been making significant contributions to not just fighting COVID, but also other aspects of health, and they've been doing a wonderful job. So it's only right that we have them in the living room for our conversation and see how they're doing.
Yep,
Exciting.
I think so. So let me just let in everybody.
Open the door, man.
I can let in everybody, man.
Welcome, 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 welcome,
We'll see how this goes.
welcome. Yeah, man. It's all good. It's all good.
So it's gonna be good. Got a bit of feedback there. I think that's everybody at the moment. We'll get some others joining in a sec.
Okay,
Could just be
so
Wayne coming through the house.
welcome everybody to the living room. It's great to have you guys, and wonderful to be in the presence of Caribbean health practitioners who are doing awesome jobs across
Indeed, indeed,
the
indeed.
world. And I can see we don't have Pauline there. Okay, so listen,
No, it's good, Johnson.
let's start in the heart of the Caribbean today. Then let's go to St. Lucia, where Alicia has joined us. And Alicia, how are you? How are you doing? And how is life in St. Lucia?
Oh, well, I'm doing great. St. Lucia, it's hot, but we are hanging in there and doing great.
And how have the whole COVID situation been treating you and your family and your staff?
Okay, well, my staff first. Well, when COVID started, again, it was new to us, and I manage a small hospital, district hospital, and a staff of 40, 45, and they were very apprehensive, very afraid.
Yeah.
Wow.
Um, but we came together as a team, and from March 9th, we came up with protocols that would govern our institution, and this has worked well for us.
Good.
That included our securities. Everybody who worked at the hospital was part of this,
Wow.
and it has worked well for us. We are able now, we can and where I'm speaking about is the Denry Hospital, and we have a lot of persons coming in illegally via the sea, and so Denry was looked at as the epicenter for contracting COVID. And to date, we can boast that we have not had one positive case at Denry
Wow.
Hospital.
Oh, that's
So
good.
we have done well as a team, and we usually have after every shift we have had debriefing,
Yeah.
and it has continued up till now, which has really helped to keep the team together. No sick leave from any team member throughout this COVID season, and
Wow.
so we have a lot to say. Bravo to the team at Denry.
Okay. That's great. That's great. Well done. I'm glad to see
Tremendous.
that everyone is
Amazing.
doing well. And what about yourself, Sophie? How have you been coping? How you been doing?
Well, when the COVID actually started, my entire department, we were moved to another area of the hospital because our work, we see patients from outpatient clinic and from GP referrals as well as from A&E. So the entire department had to be moved because we were based on the assessment unit, which was what they classified as the hot ward. So
Yeah.
they had like hot wards and cold wards where hot patients who are have got COVID positive, they're on the hot wards, and the cold wards were like separately placed. So we were moved around the hospital several times just to make sure that the patients that are coming in who are not COVID positive will not be in contact with patients that are COVID positive. But that entire process just got out the way because the entire hospital was overwhelmed with the amount of positive cases that we had. And in the end, I had to go into shielding because of my own personal situation at home, because
Oh
Okay.
wow.
they wanted to redeploy me to a different area like intensive care unit where the positive patients are. But I've
Right.
got a child that has got full-blown sickle cell and is
Oh, wow.
immunocompromised. So, and I am
Yeah.
the main carer. So being
Yeah.
the main carer of someone that has got low immunity, it meant that I couldn't be at work and go home to care for her. So I had to go into shielding myself.
Yeah.
So yeah, it has impacted me a bit because I felt like I'm trained, I need to be at work, but then there's this conflict of being at work and then protecting my family as well.
Okay.
And so,
And
yeah, it has impacted.
No, that's
Yeah.
really interesting because it highlights what our medical professionals have to deal with at home, even while they're going into, an uncertain area. That's interesting. Carry on, Mark.
And did you feel supported at work in that decision, or was it
In the initial stage, no.
okay?
No, I was not initially supported, but
Hmm.
luckily for me, I had a letter from NHS England that told me I needed to be in shielding, and also from the hematologist at the hospital. I had a letter to say that you would not be at work, or if you are going to be at work, you should be in a non-patient area. So
Got it.
that letter supported me being off work in shielding. Yeah.
Okay, great.
Okay.
Great.
But the
okay.
initial decision to shield was not readily accepted.
Yeah.
And of course we've got Pauline from Qatar. We don't often hear of West Indians in Qatar. Pauline, welcome to the living room. Just tell us what the experience has been like briefly for you and your family in this COVID season.
Well, just being in the Middle East is an interesting all by itself.
I'm sure.
So when this pandemic hit, it was quite surreal, really. And I have to say that I worked in a very, very proactive department, but it was really difficult because things were changing by moment to moment. You know, we would have this whole plan in place at 9 a.m. and at 2 p.m. that whole plan goes out the window. Um, and it was very stressful. What was paramount to us, it was like what Sophia said about having hot wards and cold wards. Our hospital is very specialized. So the decision was made by the government that our hospital should be a clean hospital. So that in itself created a whole bunch of issues because it meant that decisions had to be made about who would be allowed into the hospital, when, with what test results, for how long, where would we put them when we're waiting on test results,
Yeah.
were we going to run out of space to put these people, what was the definition of an emergency, what we would take without knowing what the test result is, and what we would put in the back of an ambulance and send somewhere else. So everything was being reworked consistently, and the information that comes out, if you imagine in the Western world, every specialty has its own professional body. So the Royal College of Anaesthetists, there'll be 20 of them. The Royal College of Surgeons, there'll be 20 of them. And there'll be 20 in the US and 20 in Australia. And everybody was putting out all this information consistently, and it was really quite overwhelming. It was coming to you on email, on WhatsApp. You couldn't turn off the TV without seeing it.
Wow.
And at some point in time, people had to make the decision to just remove themselves from that level of constant bombardment just to be able
Yeah.
to cope with the situation.
Wow.
So you did say that you had to change your plans almost dynamically. What were some of the factors in Qatar that led to that kind of dynamic response to today's plans?
Well, most of it was due to the information that was coming out because that information was changing on a daily and hourly basis. So
Okay.
in my hospital, we are a specialized hospital, so that created problems as well. Because if we couldn't take a patient, where would that patient go? Where is the next specialized hospital that would be able to care for that patient? And the next specialized hospital was the equivalent of the Queen Elizabeth Hospital.
Right.
So they're already they're tethered, they're resource strapped, they're taking all the COVID positive patients already. So it had to be a very well thought out multidisciplinary decision to say, okay, we're not going to accept the patient, we're going to send the patient somewhere else. So that had a major issue. At one point, we didn't know if we would be able to stay a clean hospital, in that we might have to accept patients, and then we had to work out how that was going to happen. And at some point in time, too, our doctors had to go to other COVID positive hospitals. So obviously, the problem with that is we work at a clean hospital, sending our doctors to a COVID hospital, and then bringing those doctors back to the hospital
Yeah.
that's supposed to be clean. So again, that created its own problems. So that's where most of it lay.
Wow.
Yeah.
And
Interesting.
if we can just travel across to the US, Shannon, it would be really interesting to hear what your perspective has been on COVID there in Boston.
Um, COVID for me, I worked at a small community hospital for a while. And when COVID began, we had no clue what to do. And just like Pauline said, every day is ever changing.
Mm-hmm.
You start your shift with one plan, and by the end of the day, it's another plan.
Wow.
We turned our intensive care unit. We same thing with clean and dirty. We tried to keep our acute patients who were COVID negative in the intensive care unit. They converted our post
Mm-hmm.
anesthesia care unit into a COVID unit.
Wow.
They transitioned a lot of the units into COVID positive units. We were dwindling on resources. Many of us were exposed. Many of us tested positive at the hospital, but it's definitely been a learning curve. In one's career, you don't ever think that you would live or work through a pandemic, but it definitely has been an emotional roller coaster, to say the least.
And on that point of emotions, Stephanie, I would like to bring you in here because you are in the heart of Florida, and Florida has been very, very much in the news recently because of the explosion in cases and how it's being handled.
Mm-hmm.
What can you tell us? In fact, tell us a bit about yourself first and a bit about where you are.
Good afternoon. Well, I am here in Fort Lauderdale, not too far from Miami. I'm a NICU nurse here, but I'm actually working a drive-up testing site we have here in Sweetwater, down in Miami right now. I have turned off the news. I have disconnected from social media because we're plastered all over the place, and it doesn't look great. Um, we have a lot of testing sites down here. The numbers are outrageous, as you all can see. We have a lot of people that come into the testing site daily. They're nervous, they're scared, they don't know what to expect. A lot of these people are coming in testing, they have to go back to work, and not a lot of people are taking it seriously here. Once the place started to open back up, um, salons, barbershops, restaurants, and things, the numbers spiked. We opened way too early. People
Yeah.
are scared, people are nervous, but people are outside like there is no pandemic. And
Interesting you say.
it's me. Hmm.
Yeah, I was gonna ask, did you see it coming? Like you saw what was happening in New York
Absolutely.
and New Jersey.
Mm-hmm.
Did
Mm-hmm.
you see it coming? And if you
Hmm.
did, you know, what was it that in people's minds, even though you could see it, still didn't pay it any attention despite what was happening in New York, New Jersey, and other places?
I mean, I can see it coming. I think a lot of people saw it coming,
Mm-hmm.
but the way things are here in the US, politically divided, I think that plays a big part in it, unfortunately.
Okay.
um, you know, Emotions as well. We talk about emotions, mental health. People are at home, they go from home to work, or they're just home entirely, and that wears on you mentally. So I think
Mm-hmm.
people were kind of using that to just say, you know what, forget about it, I'm going to go out. But, some people wear masks, some counties are wearing masks, some people are not, and they're fighting against it. So yeah,
Mm-hmm.
I absolutely saw it coming, but it's just not a lot of people taking it seriously here, and that's a big problem.
Shannon, we got a question there for you asking, is PPE usage, is it better?
Um, we were always reassured that there was an adequate amount of PPE. Um, However, shortly after we were reassured, um, I worked for a corporation, an organization that thought it was appropriate to donate tens of thousands of PPE to the city.
Okay.
Um,
Meaning
you
what?
know,
That was PPE meant for you guys?
yeah, they decided that they were going to donate it to the city.
Yeah.
And the mayor of the city said, "We have enough. Protect your employees." It got to the point where we were allowed to only request one N95 every week,
Mm.
or longer. If it weren't soiled, you had to continue using it.
Mm.
And then we had a physician who created this autoclave from like a chest freezer to clean them, which I don't think is appropriate.
Okay.
Wow.
Yeah. And then you had some management who they didn't believe in reusing PPE, so they didn't mind giving you a new mask if you needed one. But then you had other people who would question you, well, you just got one 3 days ago. Where is it?
Oh my goodness.
Yeah.
Wow.
So many of us had to go out and buy the big respirators that people were wearing, which is what I had to wear,
Yeah.
because I didn't want to put my life in jeopardy, to say the least.
Yeah.
Yeah.
Yeah, and Shana, I can see that you're shaking your head, particularly with a lot of what Stephanie was saying previously.
Yeah.
Can you share with us your experience as well? That would be really insightful.
Yeah, I mean, I'm not a frontline worker. I'm not a doctor or a nurse. I'm an epidemiologist. But I work in the section for infectious diseases at Boston Medical. So my boss is actually the section chief. So she's been in charge of all of the COVID response. And a lot of the stories that I've heard here are very similar to the things that I've heard her say. And in general, people were just extremely concerned that after that initial wave where everybody was scrambling to know what to do, you finally got to a point during that first surge where you get a routine. And so even though you still get a lot of people, you're trying to figure out, how to manage the cases. But now I'm seeing a lot of people pretending like the pandemic done. People outside having brunch and chilling out and breathing. And slowly we're gonna start to see the second wave penetrate in a lot of different cities. Ain't gonna just be like localized, like gonna spread. And then we go back, just part restart. So like I'm an epidemiologist. I look at numbers, look at patterns, I look at trends. So I just live on these websites that like feeding in all the data as it coming in, just to see how the trends are. And if anybody's paying attention to that, like they're predicting that this was gonna happen. And then
I was just going to ask you
happening,
if you could give a brief summary of what your day-to-day looks like as an epidemiologist.
Yeah.
Well, I don't know if it's lucky or unlucky. I'm not working on any COVID specific COVID data. I work in other respiratory.
You mean the other diseases out there?
Data. In outpatient and inpatient. Specifically, I'm interested in healthcare disparities. Because we know that we see it playing out in COVID. We see that the prevalence and the severity of COVID in Black and minority patients in the US is way more severe than non-Hispanic whites, and everybody's shocked and was just like, "Oh, for real, that happened?" Behave yourself. Behave yourself. You know that is happening. You know these inequities here exist, and they're just getting magnified and put on the main stage now because of the global pandemic. And now when I want to start talking about how Black people just need to eat better. So a lot of my research, a lot of my day-to-day research actually just focuses on inequities in other respiratory tract infections, not specifically COVID.
Okay.
And it's interesting to see that those inequities exist. And so I know, and a lot of people that's working with you know, these inequities existed before COVID.
Yeah.
They're rampant.
Indeed.
Do you have any publications coming out in that area?
I just had one come out, working on another one right now.
Okay.
And a couple grant ideas in.
Okay. So Alicia, you're seeing what's going on across the world, but obviously in the OCS seems to have a very different experience in St. Lucia. Any thoughts on what you're hearing at the moment?
When I heard about having to go and buy PPEs, that struck a nerve, because in St. Lucia, and we look at a country that is small and developing, and we never had a shortage of PPEs. At the hospital where I worked, I ensured at every turn that the staff had the necessary PPEs to work with.
Yeah.
Never did they have to reuse not even a mask.
Mm.
Everything was made possible. And I want to say that we had a leader in the country, and I want to shout her out now, and that is our CMO, um, Belma George. She did a fantastic job leading the charge, and we can see the successes with having only 25 cases. A lot of time it was uncomfortable for
Mm-hmm.
persons like the lockdown and certain things, but I think in the long run they saw the reasons why it was done, and it has kept us safe. Um, it really touches me because I have colleagues all over the world, and especially to hear that they had to go and buy PPEs, that touch it, that it really hurts,
Yeah.
because I feel every leader, every government, every prime minister or president should ensure that the frontliners, whom they themselves, and Boris Johnson can tell you, he had
Yeah, very much so.
Oh,
had it
there.
worse. They need to understand that these frontliners, at one time in your life, you
Yeah.
will come in contact with them, and we
Yeah.
need to take care of our frontliners. And I want to
Mm-hmm.
shout out the government of St. Lucia for doing just that. To
And
the
rightfully so.
I
Yeah.
yeah,
agree.
Yeah.
And
I
rightfully
believe
so.
so.
We were
yeah,
talking about leadership just at the beginning of this.
yes,
Mark
Yes.
and Andre said, "Do you call that leadership?" There is, and there's just a distinction between good leadership, leadership that
exactly.
really has empathy and cares for people, and then there's other leadership who cares more about you know the figures on the books
On the
and the
books.
financial performance of a country.
Yeah.
Yeah, yeah,
And
yeah.
if you don't have people, that really doesn't matter.
Yeah,
And
Indeed.
I think what our one of our audience members, who Karen Reed, has just pointed out there,
Yeah.
it can make a difference, and it has been shown to have made a massive difference in those areas where leadership has recognized the importance of keeping people safe.
Hmm.
And if I can just go back to yourself, Sophie, and just touching again on this point of isolation, because we've heard a lot about isolation and people not being able to go into work, and I think Stephanie just mentioned it there again briefly about the well-being. How have you managed in that situation where you've had to almost be away from work for an extended period of time and not being able to surround yourself with colleagues? How have you managed over that period?
So I wasn't that lucky to just be in isolation. I was working from home as well.
Okay.
So I wasn't having the luxury of just staying at home. They made sure I had work to do. So I
Oh, there.
I was provided with a laptop, access to the hospital internet. So I would be looking at the safety reports on patients that had COVID, making sure all the risk assessments have been done, contacting the departments and making sure that everything was done and in place for these patients. So I have been at home, but I was always working.
I
So I can't say that it has impacted my mental health a lot because I was in constant contact with the staff at the hospital, and
Yeah.
they were always in contact with myself. But I can imagine that
Mm.
being shut away for a long period of time has
Yeah.
caused a tremendous impact on a lot of people's mental health. Because
Of course.
being at home as well myself, I had
Mhm.
the privilege of doing the appraisal for staff that they wouldn't be able to get in touch with. And some of these staff are also in shielding themselves. And
Yeah.
yes, it has impacted their mental health because they're not able to go out and they're not in touch with their own families as well. So it has impacted them a lot. And
Yeah.
they tried their very best to cope. However, the
Yeah.
hospital that I work at had put in place strategies to ensure
Mhm.
that the HR department contacted us like every week to make sure that we're okay. We had like debriefing, where we could speak to someone. There is someone that we can always contact if we feel like we needed to have a conversation, if we felt
Yeah.
that our mental health was under threat. So the hospital also provided this mental health
Okay.
link that you could
Yeah,
contact
yeah,
the well-being team to
yeah,
discuss any issues that you may have.
yeah.
So yeah, they on that part they did look after us. Yeah, so
Okay.
Yeah, okay.
yeah, I think they
Just
dealt with that pretty well.
Okay, just to jump in 1 second, look to everyone who's joining. Thank you so much for seeing all your comments as well. So thank you for that. You know, as we always ask every week, if you can just share it on your network on Facebook, or share if you're watching it on YouTube as well, you can share that on across your network, just so we can get as many people into the conversation as well. It'd be great to get as many in, because you know we've got some medical teams and health workers from the West Indies across the world doing some fantastic things, and it'd be great if people can just come in and hear some of the things that have been up to and what they're doing and how they're coping as well. I want to jump, Pauline. So you, as a doctor, you've practiced here in the UK, and now you're in Qatar as well. I'm sure you've got some colleagues here in the UK. What's the difference that you've seen, and how have your colleagues been?
Well, I mean, I can only really speak for the experience of my hospital, and my personal experience. I can't really speak for the whole
Yeah,
country
of course. Yeah.
because it's a completely different healthcare system here and different hospitals. There are many private hospitals, and they operate slightly differently to what we are accustomed to in the UK and in the Caribbean, where we have an essentially free health service. So there were things that were a little bit different. I think for us in my institution, we were very blessed to never really have a problem with PPE. But just getting our head around PPE was really, really difficult. It is such an arduous process, and I don't think people realize what it actually takes to get into PPE safely, remain safe, be able to function at a cognitive level where your capacity is maxed out, and continue to be safe, continue to function, get out of that PPE safely, and make sure that your patient is safe. It was incredibly difficult. I mean, you put PPE on and you can't breathe, and the sweat falls into your eyes, and you can't see properly, and it was very stressful. And to quote my Arabic friends and colleagues, Alhamdulillah, in our hospital, we've not had any complications related to that sort of thing. But it was very difficult to then communicate with I'm going to get a bit emotional here, to communicate with my colleagues in the UK and hear their stories of, one of my best friends was on a ward with COVID patients with a mask and a plastic apron. And she said to me, well, I've made my peace with it, but I have to care for the patients. And that was really, really, really difficult for me to hear. And you also develop a little bit of guilt, because you think, well, hang on a minute, I used to be in the NHS, that would have been me, and now I'm over here, and I'm so much safer than my colleagues and friends who have left over there. And our family's been touched personally by COVID. My GP passed away from COVID. The nurse who used to work in the same GP service, she became incredibly ill, and it was really hard to see what was happening in the UK, because it was like, but should it not be better than this? Should we not? I don't know. It was like, for me, it was very difficult to reconcile where I was, what I had left, and what I was seeing now. And it was very hard to have just normal conversations with people. And you were just waiting for things to happen.
Yeah.
And I've had medical colleagues that have passed on in the UK, and it was just really, really difficult being here, seeing it
Yeah.
happening and hearing it happening over there. It was really hard for me, really, really hard. And I can't say that I would have wanted to be there to be with them. I can't say that that's what I felt.
Yeah.
But at the same time, the guilt was incredible. It was incredible.
And
Can I
you,
just jump in? Is
Yeah,
that all
yeah.
right?
Yeah,
Sure,
go
sure.
ahead.
Is that all right if I just jump
Yeah,
in?
of course.
Yeah, just
I think initially when the government or the hospitals got hold of how bad COVID-19 was going to be, I think they all panicked and everyone got it wrong in terms of PPEs because like in the initial stage in March, I was still at work and
Okay.
we were all fit tested prior to this, you know, what mask we should wear and what certain PPEs that we should wear. But then you had the infection control team telling us that we can just wear normal surgical masks, which then proved to provide us with no sort of protection at all. And I've had colleagues that have passed away as well myself. And they were all wearing just these normal surgical masks that was not providing them with no protection at all. And then later on, you found out that you needed to be wearing like FFP masks that are more suitable for these aerosol droplets, you know,
Yeah.
that could pass through the surgical mask. So I think they all got it wrong initially, and a lot of people have succumbed to it because of these initial decisions that were made.
yeah.
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 If
And it's quite sad because I have actually lost a very good friend. She was only
Mhm.
Okay.
30. I think she was one of the first
Wow.
nurses that passed away.
Yeah, I
And
remember her.
I remember speaking to her the Friday before she passed away, before she took ill. And that really touched home for me. And she died. She was in her 30s. And she died. She left three children. You know what I
Yeah.
mean? That's quite sad,
Wow.
Yeah,
to
it
be
is.
Wow.
honest. Yeah.
This whole point of emotion and the grief that you and a lot of your colleagues have been going through is one that we've heard consistently in the news, particularly here in the UK and in the US. Shannon, I wonder if this whole journey of grief and the sadness and colleagues and support, if this is something that you have also had to really dig deep to contribute to in terms of being around your colleagues.
Um, it, so for me, um, all the sadness, the grief, the death, and then I think what hit home for me was a lot of families couldn't even be with their families, right?
Yeah.
Because
Yeah.
all of the visiting hours and policies were now out the window.
Yeah.
I recalled we had a woman whose husband was in the intensive care unit. And because she
Mhm.
couldn't visit, she sat outside in a lawn chair outside his window while he was dying.
Jeez.
Yeah.
Well,
Wow.
Well.
We had to be these patients' family members. We had to support each other, right? Because people don't know people who are not in it don't understand what we're going through emotionally.
Yeah. Yeah.
yeah.
Yeah.
And where are you? And perhaps Alicia, you've been very well heralded in the OECS for your handling. What about this whole area of grief and support? How has that happened for you guys in the OECS?
okay, first let me speak about my own emotions. Um, it has been a roller coaster for me as well because, like I said, I have nursing colleagues throughout the world, and what I did was to reach out to them, speak to them, and try to do, a one-on-one with them, trying to keep them motivated. Um, for us as nurses, every life counts.
Yeah.
And for me, it really, really hits hard when I hear of the many deaths in the United States. And I see people taking that so lightly. I have
Okay.
family in the United States and I am fearful. And for us back in St. Lucia, how we have dealt with even the mental health issues. If a nurse were to come in or any member of staff were to come in and say that they are a bit apprehensive, a bit scared,
Mhm.
as a manager, I would give them the day off. I would give them some time off. Get
Yeah.
yourself together. When you feel
Wow.
better, you call me up and you come back. And that is what we did at the hospital. Um, we also, after, even after, right now, we have just opened up, but many of our how you call it, leisure places and just opening up. And as a team, what we have done is in two groups, because we cannot close the hospital. We have gone out into hiking, into visiting nature sites, to be fair again as a therapeutic way of keeping this group motivated, because their mental health is very important. You
Yeah.
have people coming, having to stay away from family, having to, so you need to take care of them. And one of the things for me that worked well, and I think that all other countries leaders, I never left my staff. I did not run home after work and say, well, look, my time is from 8 to 4 and I go home. No, I would remain till 9 and 10 o'clock with my staff.
Wow.
So they felt my
Oh, wow.
presence, and
Yeah.
that I think helped with the
I,
whole situation.
I think
Yeah, I
that's
can
great. But
imagine.
then what about your own mental health as well? How do you
True.
support that?
Yeah.
Because
Um,
that's given a lot of
A lot,
yourself.
of course. Yeah.
yeah, well, I am a very vibrant person, and I find I get things to do. My plants are one of the ways that I get
Okay.
therapy from my plants, and another one is my grandsons. So now I have two grandsons, and just seeing them and as they grow is
Yeah.
very, very therapeutic for me. So every day that I can, I will have them on WhatsApp, and
On
we will
WhatsApp. Yeah.
just, yeah, and we
Yeah.
will just
Yeah.
talk. So that is
Yeah.
very therapeutic for me.
So, Alicia, I was just wondering if I can ask as well, because not Alicia, sorry. Let me just get the right person here that we're looking at. Stephanie. So, Stephanie, I just wanted to ask, because not your mental health is not only impacted by what you see as well in the hospitals, but certainly in Florida, where you are. What motivates you to keep going when you see people in the streets, on the beaches, spring break, what's not necessarily taking it as serious as they should. I can imagine that has a huge impact on you as well.
It absolutely does. The first emotion that comes to your gut is anger. Why is this happening? Why
Okay.
why is everyone on spring break in the middle of a pandemic? So that's usually the first emotion. What motivates me? I have an almost 2-year old. I have a husband. I have a mother. I have friends. I have a father. But my almost 2-year old, I have to come home to him every day. Mentally, it does impact me. I am used to working and I travel. That's our normal routine with my husband and I. We from London to Iceland, wherever we can go, that's where we go, and that has all stopped. Um,
Yeah.
Once you stop that type of lifestyle, it's like, okay, what do I do now? You're home constantly, but you have to just kind of weigh it out. Okay, you want to be home, or God forbid, in a morgue somewhere. I know which one I would rather, so I stay home. I go to
And if I'm
work
not
and I make sure.
mistaken, did you leave a shift to be part of the show today as well?
I did. I absolutely did.
I just
I
want to
and
say
I
thank you for that. We
Well,
appreciate
Thank you
it.
Oh,
so
I'm
you're
sure our
much.
welcome.
audience does also.
Thank you
You're
so
welcome.
much.
And I was running a little bit behind time because I have my protocol when I leave work. I
Yeah.
have to stop off somewhere else before I get home, shower,
Yeah.
do
yeah.
house, change my clothes. And that's kind of how I do things. I don't like to run into the store. Grocery shopping, just deliver it outside. I'll pick it up with my gloves on. That's just kind of what I do. Do I miss
Yeah.
going into the store and picking up my own bread and apples? Sure, absolutely. But I can totally give that up for,
Yeah.
a bigger cause.
Yeah. No, thank you. We
if
appreciate
we
it.
if we can, thank you so much, Steph. If we can probe a little bit more on that point on family, because we've talked about colleagues and how health is a very team oriented sector. You work in teams and you get very very close to people, and but then you've got your family, and I'm sure Shayna, family has been a big part of this journey, and the emotional bit. How has that been handled in your case in terms of family?
It's been hard. I haven't seen my family since they were here for Christmas last year. What made it a little bit more difficult is my aunt passed away recently, and so my family from Barbados couldn't come to the funeral. I couldn't see her before she passed away because obviously of COVID, so she couldn't have visitors, and we went into lockdown right after the point when I would be able to see her. I believe I went into lockdown, and so I wasn't able to see her. So that was actually extremely difficult, especially because me and my family are very close. And I just wanted to make a comment about what Stephanie was just talking about yeah, especially people in Florida and in the US just walking around as if the pandemic has ended. And I know people want to spend some of their families who are sick of being inside. And honestly, public health messaging has been, and I think there are two prongs going into that. There's been inconsistent public health messaging to the public. You know what I mean? I feel like when you're in the middle of pandemic and everything crazy, you need concise, to the point messages. Stay at home. When you
Hashtag.
see people, when you and tell people you ain't really got to stay at home, but when you left home, you can go and sit down in the bar, but make sure you 6 feet from the body next to you. Make sure you put on your mask if you go to the bathroom. Take it off when you sit down to drink. No, it ain't gonna work. If the government allowing you to go to a bar, people that want for 4 months going to a bar.
Yeah.
If the government you go to
Absolutely.
the beach, you ain't gonna think to yourself, well, the beach around, I probably should go back home. People gonna
Well,
people gonna still go to the beach.
Yeah.
but
And
that's what you're seeing it here so much. The moment the pubs are open, everyone just flocked to the pubs, forgot social distancing, forget everything. And now they're rethinking, oh, maybe we need to close the pubs so we can open schools. I'm like,
Yes.
what do you think was going to happen
Yeah.
when people who are home for 4 or 5 months,
go
here, pubs are open?
yeah,
They're gone.
and
They're
it
gone.
was very a lot
They're
of
gone.
people. A lot of people in the US as well are just very individualistic. They don't think about how their behaviors, and you don't think about how your behavior is going to impact somebody else. I want to go home. I want to see my mother. I want to see my grandmother. But I ain't
Yeah.
getting on an airport, getting on a plane, getting another airport to go and sit down at my mother's house. My
Yeah.
mother is old. I love my mother, and my grandmother more than anything. I'm not going to put their life at risk just because I'm sick of saying I'm in Boston.
Yeah. Yeah.
Oh, yeah.
That's just
Yeah.
not the reason I wear.
No,
Yeah,
it's a
yeah, yeah.
it's a valuable point. And
No,
and
it's
Shannon, the same question around family, and how have you been coping in terms of your immediate family?
Well, initially, I had to separate myself from my mother and my daughter and kind of be by myself. I honestly had I had emotional breakdown because I was so isolated from everybody. It was work home, work home, work home, work home, death, PPE, lack of PPE. Am I going to die
News.
today at work? Am I going
Yeah.
to go home today? Is this the day I'm going to contract COVID? What's going to happen next? But thankfully, it was sometime in April, right, Andre, where we had that big.
Yeah, we had a family
We
Zoom.
had a Zoom call with people with everybody, UK, US, Barbados,
Yeah, but it's all over
everywhere.
the world. Yeah.
And we were on Zoom for 4 hours?
Really long, yeah. But it was good. It went
It
up
was
pretty
good.
quick.
I needed it.
Yeah.
We were in lockdown at that point for what? A month and a half, almost 2 months.
It was fairly early on still. Yeah, it was pretty early on still.
But going from living a life to doing absolutely nothing.
But
Yeah,
but
that's pretty
that
interesting.
has shown how the support of family is so absolutely crucial.
Absolutely.
And Pauline, I'm sure it would have been very much the same in Qatar. You've had your teams, you've been providing support, but family.
Oops, you're on mute. There you
Yeah,
there
unmute
you
the
go.
mic. So it's my husband and I
Okay.
here. So we are both away
Wow.
from our family. My parents have passed away, but his mum is still alive, and she's elderly, and she had to self-isolate, and she lives on her own, so that was stressful. We were supposed to have been home for 2 weeks in July. It was our daughter's and son-in-law's birthday, and we missed that, obviously. And we've had deaths in the family. I tell you what, having a funeral online is a very odd experience. But
Right. Yeah.
that's what we had to do. We had to attend 3 funerals online.
Wow.
That was intense. That was, I mean, we come from a culture where after a funeral, you have that
You
support of
get together.
everybody that
Yeah.
is there.
Yeah.
You get together and you tell the stories and you drink the drink and you have the laugh. And but when it's just two of you at your dining room table,
Yeah.
and then the funeral ends, and it's like
That is tough.
It's surreal.
that that
Yeah.
that support system
It's completely
was
gone.
just not there,
Yeah.
and that was probably one of the, aside from the person's passing, that was
Yeah.
that was incredibly difficult, because I didn't actually realize how important that gathering after a funeral is,
Yeah.
how
Yeah.
much that
It's
aids
part of the journey.
your
Absolutely.
Yeah.
grief,
Yeah.
yeah, and the process
Yeah.
of getting through it. And we
Yeah.
did it 3 times,
Wow.
and each time it was just a little bit worse.
Yeah.
And
And then the
you know,
impact
and
of then having to perhaps go back to work and deal with death again. You
well,
know, in some cases
it's
for,
just
for
going
many of the
back to
guys,
work, period. It's
yeah,
just going back to work, period. It's like Shannon said, is this the day I'm going to get it? We had colleagues test positive. We had half the maternity ward had to go off at one point, and that puts stress on the staff that's left, because all the work still needs to be covered. We all still need to be there. So we were
yeah,
all working extra shifts to to
yeah,
to cover each other, and so, and the patient is at the forefront. You still have to get up, get dressed, and turn up and take care of your patient. And
Yeah.
you have to do it in spite of all of this. And whilst it sounds really nice to say, well, you know what, I just attended my third funeral, I can't come into work today. Yeah, but we're already down 5 people.
Yeah.
yeah,
So, you kind of just have to suck it up. And
Yeah.
like I said at the beginning, one of the great things was I'm working in a division where we really work well as a team, and we take good care of each other. And I don't know how I would have coped if I was not in the team that I am currently in now.
Wow.
They are absolute superstars. My immediate line manager, absolute
Yeah.
superstar. And that made it bearable. But the constant worry was really difficult. And one of the things I found online, because you find yourself searching for ways to cope, was and somebody, I forgot who said it, watching people on spring break and you're going through all of this. And I found a very inspirational young lady online called Galen Lee, and she's a violinist with osteogenesis imperfecta. And she was the first person that introduced me to the concept of the loving meditation. And it came about from that same thing. She's ill. She has this disordered, if she catches COVID, that'll probably be the end of her. And people are walking around and going to the beach. And she said, I needed to find a way to be okay with that so that I could be okay. And you guys should check out. She was really inspirational. She really helped me get some perspective on things.
well, interesting.
I was gonna I was gonna
So
comment
go ahead, Phil.
on that there. The themes I'm hearing coming out are family, team, community, connection. These seem to be almost the foundations that have helped us all get through this period of grief. And what you just mentioned there, Pauline, or who you just mentioned there as well, she got to that point of having to be okay. No, I could imagine for people who don't have connection to others, be it a good support team, good leadership, good family that they can connect with, and so on. That journey must be extremely, extremely tough to cope and go through that cycle of grief. From, the cycle of grief talks about going through denial and anger and depression and bargaining, and finally into acceptance. Are there some, because I know there are some people out there, and we are still in grief, but those of us who have not lost people, we are still in grief because our worlds have changed. The way
Yeah.
we engage it, the way we can freely move and see others, that have changed. Do you have any thoughts for people who are alone? How can they sort of deal with this?
That's a really tough one, and you are 100% correct. If you don't have that support system, and we will see it, and we haven't seen the worst of it yet, A lot of people would have borderline mental health issues, but they coped because they could go to the gym, they could go to the pub, they could,
Yeah.
go for a walk and feed the ducks. And okay, they may have been alone, but
Yeah.
they had these other outlets that helped
Yeah.
keep them balanced. And during lockdown, all of those were taken away.
Yeah.
And we have yet to see the true effect of COVID and the impact on divorce, mental health problems,
Yeah.
domestic violence, abandonment, you know, children who will develop problems. We haven't yet seen the true impact. The only thing I can say is that what I've noticed is within every geographical region, there are phone numbers, there are lines. For instance, in the UK, there's Calm that people can phone.
Yeah.
There will always be, the go-to ones um, that have existed before.
Yeah.
I
Yes.
know think people like the Red Cross and these people, they've put a lot of effort into having more people available for people to be able to phone up and talk to them. And now that the lockdown is going, the worry is, and I said to my husband, you have to be really careful about this, that you don't develop this paranoia that then does not allow you to get back into the community when you can.
That's
Yeah.
you
interesting.
know
That's
it's this idea of having to wipe down all your groceries. I mean, if you start thinking about that, I mean, really thinking about it, right, you
Yeah.
will never ever stop wiping down groceries,
You got that
and
right.
that's just
It's
beginning of
so
a
true.
spiral that just
You got
doesn't
that right.
end.
Yeah.
yeah.
And there is that component of it as well. People who are now so paranoid that now the community is open, they cannot bring themselves to go out and get the help. So what we have to find ways of doing is going and finding those people. And again, it still comes back to community. When you know you have an elderly neighbor who lives on their own, go knock at the door, go knock at the window, go shout over
Yeah.
the
Yeah.
fence.
Yeah.
If you know you've got somebody who's a carer for somebody who has a disability, go knock on the door, go knock on the window, shout over the
Yeah.
fence. We can't just wait for an institution to do it. We as
Yes.
individuals actually have to go out there and be
Yeah.
part of that community and bring that to support to people, because let's be honest, we know who these people are. We know who
Yeah.
they are. We see
Yeah.
them, we
Yeah.
know them. So it's up to us as neighbors, as healthcare providers, as keepers of our brothers and sisters, to just go
Absolutely.
and knock on that door and say,
Yeah.
are you okay? Are you all right? Is there anything I can do for you?
I was
Yeah.
gonna,
And I
I
think
was-
because the volume
yeah.
of people that are going to be going through this is going to be overwhelming. And I think if we as individuals don't step up to it, it's going to be very tragic.
Yeah.
I was going to throw this out to anyone and,
Yeah.
and
Yeah.
everyone. Do you think there are elements of being West Indian and or upbringing, being part of the diaspora, or
Oh
being
yes.
from that community? Do you think there are elements of that have
Definitely.
helped us to cope and
Definitely.
adapt and go after community that others might not have had?
I think that's definitely us being West Indians. And I like what Pauline said. We need to
Me
go
too.
out because in communities, we all live within communities, and we do know the persons who may, we need to check on. And we can go a little further. There are so many people out of jobs, yet we are privileged to have a job. We can do a little parcel of groceries when we do our shopping and give it, because there are people who have children and they may be, going through a difficult time. So a little parcel of groceries when we do our monthly or weekly groceries would go a long way. So I think it is also open up for us to feel, to be, to be in other people's shoes. And I usually tell my staff, we are privileged. Despite the issues, we are privileged. We get up and we go to work every day. There are many homes where both husband and wives, especially in the tourism industry, are out
Yeah.
of jobs.
Yeah.
We need to reach out. And mental health will be a big issue when these persons cannot provide. Suicide will be another issue. We need to, as each other's keeper, start reaching out to people. We haven't seen our neighbor for the last 2 days. find out she
Find
might
them.
jolly
Yeah.
well be going through something, and we would have just been there
Yeah.
in time.
Yeah.
Yeah,
That's
Yeah.
what
no, I agree. A quick question as well. So, and I guess I could start with Sophie on this one. Is so BAME, which is a term used here, Black and Asian minority ethnic. All the trends show have been disproportionately affected by COVID-19. To what extent? I mean, first of all, how have you seen this manifest itself in your hospital? And you know, and perhaps Shane as well, you can tell me about trends and stuff as well afterwards. But how have you seen it? How has this then fit into your psyche when you go to work as a black woman, as a nurse, and you're going into an office, going into a situation which says that we are the most people affected, adversely affected? And is it really just about us, or is it an economic, a socio-economic question as well? And that one's probably more for Shayna when you look at your trends.
Well, I can speak from my perspective in the short time that I worked within the COVID period, and also prior to that, being from the Black and Asian ethnic minority team. You find that majority of nurses and doctors or healthcare professionals from that team, we're mostly the frontline workers. We are the ones at the forefront. We're the ones that they would put us first to do anything that they wouldn't want to do themselves. And this is why the impact is so great amongst the BAME society, where we're the ones that will get the virus first or become infected first, because we're at the forefront of everything. We do the most demeaning sort of work that or white counterparts wouldn't do. So from my perspective, that's the reason why you'll see a majority of us being succumbed to the infection more readily than our white counterparts. So that's my take on it. Yeah, from a nursing perspective, yeah.
Yeah, I agree with Sophia. I mean, I think when it first came out, I think people wanted to make it seem as if there was a biological
Yeah,
reason
yeah,
that
that's what I was
minorities
getting at.
were
Yeah.
That was
far,
coming out.
which is not the case. It's absolutely
Okay.
ridiculous. I mean, like Sophie pointed out, African Americans, other minority groups are working in jobs which are considered essential. And so even though they weren't treated like essential workers, so they were at our supermarkets, they were delivering groceries, they were delivering food, delivering your meal. And so they were just at a higher risk of being exposed. Additionally, the prevalence of comorbidities like diabetes and hypertension is high. And again, people want to make it seem as if once you black, you can just got diabetes and hypertension. Behave. There's a socioeconomic structures in place that make it so that minorities are at higher risk, because a lot of us live in food deserts. A lot of us live in neighborhoods that don't have proper infrastructure that you can work. A lot of people live in neighborhoods that do not have parks. So even at the point in the pandemic where people could go outside and just walk around the park when everything is shut,
In
people
projects,
live
small
home in
high
those
towers and
tiny
stuff. Yeah.
Yeah.
apartments a project without access to food, without access to for areas that they could walk, and still having to go to work in supermarkets and delivering things and at higher risk for COVID. And then the people in power stunt and say, oh, so they think making it
No.
it's not a biological thing. It's socioeconomic factors that are at play and really increase our risk of not only catching COVID, but then also having the adverse outcomes, because then you get to the hospital and compared to your non-Hispanic counterparts, you got a longer ED, or they just ain't testing you at all and send you back and tell you nothing wrong with you. Then by the time you get back to the hospital, you're real sick.
Yeah.
And a lot of that is not being addressed. They want to make it seem as if that's not happening. But I mean, we've seen the reports, we've heard, and I'm sure Shannon and everybody has heard stories from people personally that this has happened to. They were meant to be, and they get told, you ain't got no COVID, send back home, and then you pop down. No, because sorry, that is really that really frustrated me when that first happened. I was
No,
actually
Yeah.
sad.
completely understand.
But
Yeah,
there are times when you try to address issues that you think there's some sort of inequality, and you'll find that your managers, or because of the hierarchy within the hospital settings, and most of these people, they're mostly white that are at the top of the hierarchy. You go to them and you point out certain issues that you're facing from the BME, BAME community, and they'll tell you, oh, you're just being too sensitive and you're taking it like
Mm.
it was not meant in that faith and stuff like that. But now that COVID has occurred, it has highlighted how much of this inequality there is in the BME the BME environment that we all work in, because it has highlighted to them that we are the ones that do the most demeaning jobs. We are the ones that are not promoted more likely. We might go for jobs with our white counterparts, but we don't get the jobs. Not that we're not qualified enough to get them, but we just
Mm-hmm.
don't get them. But one of the things I can say about my hospital that I work, one of the strategies that they've put in place is that on every interview panel, there has to be a BAME staff on that interview panel to make it the decision to appoint the person an equal decision, not
Yeah.
just a white person alone that will just make that decision. So that's a good thing that they brought into place. Yes, I just wanted to add that in.
No, that's useful.
No, that's
And
useful to know.
just a point, Stephanie, because I think we are at a really defining moment right now where there are some places in the world where they have started to think about how do we move on, how do we open up, and where do we go next. But it feels as though where you are not participating in that conversation quite fully because you're still grappling with everything else that the first wave of this pandemic has thrown at you. So as we start to think about going forward, what is that experience like for you as a seasoned practitioner? Where's your mind in as far as looking ahead?
Right now, it is very hard for me to look ahead. I'm literally maybe week to week. The questions are, when is this going to end? When will it be over? And no one can really answer that. In a place where I am right now, our leadership is not leadership. I mean, they have the title, but they're not doing the job.
Okay.
So where I am with, okay, where are we going to take this? Where am I going to be? I honestly can't say. Um, Planning for the future, that's hard to do because you don't know what's going to happen tomorrow. You don't know what's going to happen next week. So it's really hard for me to even think beyond the next day. Okay, so I just honestly don't know. It's really hard to answer that question.
Yeah. And Alicia, even looking forward, we see different Caribbean islands are beginning to reopen the tourism sector in different ways. How are you feeling about that, and how is the health workers, professionals feeling about that at the moment? Do we feel that's the right time? Do we feel we can now cope? We understand it a little bit better?
Okay. I know a lot of persons are still very apprehensive, but it is our new normal. We will have to learn to live with COVID. How do we do that? By keeping to the protocols. Wear your mask, wash your hands, keep your 6 feet distance. And I think once we continue to do these things and to ensure that we educate, you understand, family members and each other, I think we can get through this. Because if I can say, St. Lucia has opened its doors.
Yeah.
Very importantly, you must do the 14 days quarantine once you come into our island. If you don't and you're going to break it, you will be put back on a flight back to your country. And for me, that is very important. So we take these things very seriously. You are coming into our country, you have to go by what the protocols that are established within our country.
Yes.
For now, our government continues to pay for quarantine. It's free. I do not know for how long, and people are still complaining. But I tell you, I sometimes wonder what our government is thinking, because you get free meals a day. You have nurses throughout.
Wow.
24 hours taking care of you. You have your free meals, and I'm telling you, free good meals from
Of
what
Free
I've
course.
heard.
Wi-Fi as well.
Wi-Fi, you have a bed, you have, lovely scenery from the hotel. So I am
Wow.
saying, listen, we have to live with it. We cannot keep our borders, whether we like it or not. It has economic benefits, so we have
Yeah.
to think of that because a country has to run. And so for me, we just need to take it personally. Every individual have to personalize this pandemic.
And can I just ask a question of you, Alicia? Because I've noticed that there have been a couple of breaches in some Caribbean islands from people from North America and from the United Kingdom. Do you think that they are just not wanting to follow instructions from us as people living in smaller countries? Do you think there's an issue at heart there?
I could answer that too.
I think so.
Hi,
I think
Andre.
so.
All
It's
right.
also the United States. I think so. But that is where we show them that we as Caribbean people can take some serious stands and put them
Absolutely.
back on a plane
Yes.
back to the country.
No, I agree with
Absolutely.
that. I can't remember which country it was I saw where someone from the UK breached, but they weren't
Yes.
fined in the same way how a local person would be fined. And I think that's wrong. You
That's
know,
wrong.
if
That's
the
wrong.
things
Yeah.
if you got the protocols in place and the punishment in place, that should
No
be for
matter who
everybody.
breaches it.
You know.
Exactly.
But
Agreed.
we want to open up tourism so badly, and we still want to say, hey, we welcome in everyone, but we're still a bit more deferential to tourists than our own people, and we can't be
No,
that way.
we cannot. We cannot. We cannot. It will cause problems. We
I
cannot.
agree. Shayna, I'm wondering, as people look to open up, across the world, what are the trends looking like? What are they saying? Are we likely to see a second wave of this in the winter? What are you seeing from your vantage point?
I think most people believe there's going to be a second wave. And a lot of the experts, I don't even think they believe that it's necessarily going to be a second wave. I mean, number one, second waves are just kind of
Yeah,
natural order
yeah,
of
yeah,
things in
yeah.
the
It's about
epidemic.
how big it
It
is.
tends to
Yeah,
happen.
yeah,
Yeah, but so many models and so many experts felt like if we would actually follow protocols, if we would actually have just not only stayed on lockdown a little longer, but had consistent lockdown protocols. Because you could be in a state and the lockdown protocol for your city in the state is very different to the city that next door to yours. And
Yeah.
so even if you got something controlled in your little pocket, your little geographical pocket, it don't matter if the people that butting you on all you sides doing something completely different. And I think that's the issue that people trying to grapple with as they look to reopening, as they look to thinking, are we going to get a second wave in the fall? What I would
Yeah.
say is that some places are being good with understanding that things can change. Whereas
yeah.
before everybody was just like, we opening all these schools because children ain't getting sick, they realize, okay, maybe that's not true. Maybe children might get sick.
You
And they
can
kind
get sick too.
of finding
Yeah.
the models and trying to rethinking about how they can actually like look at school in the fall. And some places just completely ignoring new information. They're pretending like there's information in there. And they
Yeah.
say, no, we doing what we're doing regardless. So I think that because of the inconsistencies in the way people applying information to make their decisions, we can see a second wave. I'm very uncomfortable with how numbers are looking,
Yeah.
to be honest.
Yeah.
Like, I ain't gonna lie, I am very concerned for how I think things are gonna look. I think second wave might even be a little worse, to be honest, because
Okay.
I,
I was just gonna ask, with this second wave coming,
yeah,
what has changed that
change.
might in terms of people's mindset, in terms of the vaccine. I know that's still
So
perhaps many years off.
so that's the thing. I think, and that's where we can get problems. You ain't got two schools of people. You can get to a point where if we get to a second wave, you can got the school of people who are not going to be very concerned or take it very seriously because the
Yep.
mindset can be, well, we survived the first one, like we good. The second
Yeah.
wave, we gonna soldier through and we gonna be all right. And then you got people that were waiting for the vaccine, and then you got a whole bunch of people that like, even if this vaccine come, I ain't taking it. And that there's your reality.
That's you, Shannon.
Okay.
Well,
And then you got
I
the
will
people
not
that
be the guinea pig.
Come
Oh,
on,
you
tell us
too,
a bit.
Steph. Come on, you gotta
Let's hear
tell
this
us
from a
now.
medical perspective, because this could be interesting.
And this is the problem. A lot of people feel like them gonna be guinea pigs. Now, if a vaccine they come out 3 months ago, I'd be like, well, you're risky. But if we sit down long enough for these men to develop something decent and actually get to phase 3 trials and actually enroll a diverse and large group of people in several locations, because
That's what exactly.
the articles about vaccines, them think the vaccine came out in January and everybody can get it. No, sweetheart. Like the men got to do a whole phase 3. They got to enroll more people. They got to make sure they enroll diverse people. So you need to know it's working old people, young people, pregnant people, black people, everybody. It got working everybody.
Yeah,
I
there's a
don't.
race. There's a race on at the moment across the world to see who can get there first, and it is not giving consideration to those factors.
And that's why it's blowing my
That's the
mind.
dangerous thing, actually.
Absolutely.
We need to be working together to get the best vaccine out there. We ain't gonna be worrying about who win this race and who can make the most money. Because the other side is that countries now actually gonna be scrambling to get together funds to make sure that when a vaccine come out, they're gonna actually be able to get their hands on the vaccine. Madness. Why is this a discussion? Why is it a discussion of who can get the vaccine first? If a good vaccine out, everybody needs to get it. And about who got more money. And I think that's why people also don't want it. Because I'm just like,
yeah, you can see the profiteering.
I think though that's a product of what we were talking about before regarding leadership, because I think from a global perspective, you want to see some leadership and about how that process could work, or that we're all, quote unquote, as we all saying all the time, that we're all in it together globally, and perhaps see how that works. But I think right now there's this whole me versus you attitude that's taken over the world. I'm not gonna talk about where that may have came from or what may have started it, but there's this whole me versus you, us for ourselves, us before you, we're gonna buy everything, and look after ourselves first, that's going on. And when you're dealing with a pandemic, it's just not the right way for the world to be at the moment, and that's my fear.
I completely agree. I think that's what's driving this vaccine race and why it's making people extremely hesitant and nervous about even taking the vaccine, especially when you hear things like the company that leading the charge over here does work directly with the president and left his job right after that to go and join the Trump campaign, but he's a majority still. Like people ain't gonna want vaccine, like people ain't gonna want it.
But I like this point, because that's true, because with all the conversations that you hear around a vaccine, you always hear the financial questions come into the same conversation, which tells me is more a profiteering project than it is a health project that's going on. So Pauline, in Qatar, what's the conversations like around securing, using, trusting a vaccine?
That is a very big question.
I know.
And I have to say I am a small fish in a big pond, and I don't really have an answer to that.
Understood.
I suppose we here are, everybody knows the Middle East has lots of money, and I'm sure there is investment into these companies worldwide. I can't really comment on them. I don't know anything about that. But what Shanna said is 100% correct. Both about this vaccine is not going to be immediately available as fast as people think it might be. And two, we do need to be very careful that when these results come out, that they're actually credible from credible institutions. And it is sad to think that in a worldwide pandemic, our leadership has not come together and said, right, we need to view this whole information sharing thing and communication and working forward. This is a different conversation. And, China is doing their own thing, and the US is doing their own thing, and the Russians are doing their own thing, and everybody's doing a thing, but nobody is doing this thing together. So if the Russians come out with it first, you're quite right. Well, who did they test it on? They tested it on themselves. Does that mean it's going to work for the Bami population? Does it mean it's going to work for the African population, the Arabic population, the Northern European population? You don't know. So it's an incredibly difficult question to answer from any point of view, I think. And until somebody actually raises their hand first, watch this space.
Yeah.
But of course, our audience will be listening very intently because you guys are on the front line. You are the medical professionals, and you will be looking at this yourselves and making genuine comment without motive. So, Shannon, I saw that you were shaking your head vigorously and sticking your hand up quite high to say, "Not me." So,
Both her and Stephanie.
both you and Stephanie, let's
Well,
let's
we're-
get your
Jennifer
perspectives.
Chow.
Not
Let's
Not
get your perspective.
happening.
Not happening.
Why?
It's
What's
not,
your thought
and
process?
same thing that Sheena said. It's the same thing that Sheena said. It has to be a well diverse study to ensure that this vaccine can cover everybody. Of course, you know, we don't know. I think it's going to be a long time coming before we get something that is appropriate, adequate, and can safely vaccinate everyone.
Yeah. It feels like everyone is getting in each other's way as well.
Yeah,
It seems
yeah.
like whenever someone says we got positive results, another country or company or media house is always anxious to say,
So do we.
I wouldn't really trust them because of X. And then someone else says, yeah, we found some good results. The same media house or country that kind of poo-pooed the other guy goes, yeah, this is good. Then the other guy's going,
Maybe not,
too
right.
sure.
The same thing with the
It
first
makes you
drug,
not
right?
sure what you can trust really as a person.
I agree, because initially when COVID started, we were treating with remdesivir, hydrochloroquine, right? And you have people eating like their bottom of their fish tank because that is what is an ingredient in some fish tanks. And people are like killing themselves. You know, you have number 42 who are like telling people this is a cure, this is the cure, and people are
45.
dying.
Yeah.
45, whatever number he should be.
Whatever number.
But it's all financially.
It's just too
Motivated.
complex.
It's financially
What if we
motivated.
don't know?
That's the
Yeah.
problem.
There's
So,
so much
you
we
know-
still don't know. I mean, we still don't
Right.
even know something as simple as can you catch it a second time?
You
still
can't.
don't know the answer to
I
that.
know one person that caught it
So the
twice.
most basic, infectious disease questions, we don't actually have an answer to.
Yeah.
And,
Yeah.
you would like to think that everybody is doing the best with what they can at this point in time.
Yeah.
But it is difficult. It's difficult for us as healthcare workers. When people say to me, well, what should we do? And I'm like, I don't know. I'm sorry, mate. I don't know.
Yeah.
Because
So, I mean,
nobody knows. And it's
Yeah.
disappointing, but it's such a complex situation.
Yeah.
I think it's gonna be a while. And the only thing we can do is really try to protect ourselves as much as possible. Don't look at what
Yeah.
the other guy's doing. You do what you know you should be doing.
Yeah.
I think
And
that goes back to Alicia's point of it needs to be personalized in a sense. But I do get a sense that the public is being shielded from a lot of information, from the reality of we do not know, and that there are so many unanswered questions.
I think that's really it.
I think that's an issue. And do you think we should be at a stage where do you think society has let's say sort of evolved or has become as sophisticated enough to handle that sort of information and that sort of reality? And would it be beneficial to expose that reality to society that we don't know? There's a lot of unanswered questions.
I think it might be. I don't know. I feel that's a double-edged sword. I think it could be helpful and it could be a hindrance because I think it's actually really important for people to understand that there's a lot that we do not know. And as information, and as you get more information, as you learn more, then the guidance that you put out is going to change. But people,
Yeah.
but I mean, we just watch the news. We just hear people talk. People get so upset when the CMO or Minister of Health go and say something different to what they said 2 weeks ago. Then people just get back. Be like, you don't know what you're talking about. Last week you told me this, but that's what it is when you're playing at the you can't in the middle of a pandemic. You got to take the information as you get it,
It
and
comes.
improve your processes. And
Yeah.
I think maybe that's what we need to do. We just let people know, you know what, we know what we're doing.
I agree with that
We're
one.
learning every day, and we can change as we learn. And we're not just gonna hold on, but we can know that we got one of the best interests at heart.
I think there's a difference between we know what we're doing and we ain't got all the information yet.
Yeah.
Right.
Yeah, I would say we know what we're doing, but
What we're doing is ready to just
Fair point.
information
Fair
comes
point.
to the forefront.
Yeah.
Yeah.
Because
We
if I
have a
hear that,
term.
I go in straight to St. Lucia and put myself in quarantine.
You
You sure?
understand?
Yeah, even for just for the food, man, for sure.
I feeling
And the
so.
views, and the views.
And
Don't
the
forget
views
the
of the
And the
views.
view.
mountains.
Yeah.
Yeah. Listen, we have a term that we use here where we say, we're flying the airplane and fixing it at the same time. And that is precisely what it feels like in this particular season. Sophie, you wanted to jump in there with something?
Not really, no. I was just thinking about what Alicia said earlier about, if there's a staff member that had an issue and presented themselves to her, she would have given them the day off or something to that effect. So
Yeah.
I was just smirking on that point, because that would never happen if I had to go into work and say, "Oh, I'm having a bad day today. I don't think I should be at work." I would be told, just suck it up and carry on. So yeah,
Wow.
that's it.
Wow.
Yeah.
I think people are. I think sometimes we don't give ourselves credit as human beings, as far as on what we can consume, as far as information is concerned. I think most people would be, and I don't know if we've actually lost the time now, but I think most people would actually would have been okay with hearing, look, we're having an event that we don't understand. It's going to take us time to understand it and therefore produce a vaccine that's going to work and before we get on top of it. But I think what has happened is people saying we're going to have this by then, a few weeks from now. You had 45 saying we got 25, it can go down to 1. You got, Boris over here initially saying, oh, it's happening over there, we're okay, our great NHS is gonna be okay and save us. And then in the Caribbean, obviously we are taking our lead from these sources and we aren't too sure. Although thankfully most of the Caribbean islands realize, okay, you guys don't know what's going on. We can do our own thing. Check y'all on the other side. And that seemed to have worked out. But I think the problem that you're having now is that I think that's what they want to say now is we're not sure. But the problem is you just spent 4 months giving me 50 different answers each week. To tell me we're not sure now, that's going to be panic. And I think that's why you see governments like here in the UK trying not to go back into a second lockdown, but say, oh, let's open up, let's take it slow, because I think they know. I think it was Stephanie was saying they know they don't have an answer for the next 4 or 5 months.
Yeah.
They know they don't want to turn back because of the panic it's going to cause in the economy and people's mental health, and what's not. So they're just trying to keep moving forward by opening this, opening that. And I think that's what's happening.
It's all to try and engender a feel-good factor while you still can, because winter is ahead and it's coming quickly. And the one thing many of these countries have not done is to go through a winter with this pandemic. We've all hit this during spring, and that's been a very different feel, spring and summer and the feel-good factor that the government is trying to engender. But suddenly, the children are back at school. They've got flu, and COVID is still running rampant. And I think from a lot of people's perspectives, that is what is really starting to come at us now. We are recognizing, like many of you said earlier, look, we're going to have to find a way to live with this. But then there's this next thing that's coming. And as we look towards those months ahead, I wonder what you would want to say to anyone in our audience who might be getting a little bit nervous and thinking about how do we balance up all of these things that are coming at us over the next couple of months. Particularly you, Pauline, because I'm sure you've got a lot to think about as we transition, and it would be great to hear what you would like to say to our audience as they think about the months ahead.
My friend said to me a couple of weeks ago, the only thing that we know is that we don't know. What I would say is we have sort of basic principles, which Alicia talked about already. Wear your mask, wash your hands, don't do things, don't put yourself in crowds where you don't need to be in crowds. Because at the moment, that's the only thing that we are pretty sure can help control the situation. So we need to stick with the basics. We need to stop being so arrogant and thinking that we know better. It's a piece of paper over your face. If you think it's difficult breathing with a piece of paper over your face, is going to be really difficult trying to breathe with a tube down at the end of a ventilator.
True. Good point.
So, you know, we have agreement on some very small and basic things. And it's probably the basic principle of all epidemiology and infectious disease. Cover your nose, cover your mouth,
Mm-hmm.
wash your hands.
Mm-hmm.
When you're not well, stay home. You know, it's the same thing that you would do if you had a flu, if you had a stomach bug. It's all the same basic principles. You don't, you don't need to, you can just go and dip in the river 9 times. You don't need to move a mountain,
Yeah,
right?
true.
Just do the simple things. We don't know what's going to come,
No.
and we don't know how COVID is going to react throughout the flu
Yeah.
season, which
Yeah.
affects different countries differently. It's more an issue for the not for our West Indian climate, but more for the temperate climates. So there's going to be a difference there regionally as well.
Yeah.
And all I can say is what we all know already: stick to the basic stuff, um, and don't look at other people.
That's
Find
interesting.
your peace. Find your loving meditation. Just find your way to live with this and do what you know you're supposed to do. I'm not an infectious disease specialist, so I really can't make comments about numbers and predictions and what the latest, biogenics is saying. I can't talk about things like that. I can only talk about it from a generalist perspective,
Yeah.
and it's basic infection control,
Right.
all the stuff you know already, and
Yeah.
that's what seems to work.
Yeah.
Yeah.
And Alicia,
I,
for you,
And don't panic.
yeah.
I can
Don't
see you
panic.
wanted to talk,
Okay.
and I was going to come to you as well, Alicia.
Yeah.
Even looking ahead for the region and how we continue to cope and manage with it from your perspective, what's your word for the region?
Okay. My word for the region is, again, like Pauline says, um, basic infection control. Um, Also, build your immune system. Eat healthy.
Yeah.
These are some things that will help you fight the flu, um, and also help you with any other, of these diseases. Also, like I said before, um, you're going out, wear your mask,
Mm-hmm.
washing of your hands, keeping the 6 foot distance will assist us in fighting this pandemic.
Wow,
Excellent. Good word.
that's awesome. And of course, Sophie, in the UK, we are in one of those areas with the temperate climates, and we've got winter coming. What would you want to say to those who are listening and watching?
Well, I echo what Pauline and Alicia has also said, just to carry on with the basic hygiene needs. Keep your immunity up, take your vitamin D tablets, and eat healthy and wash your hands, wear your mask, and just look after yourself. One of my major concern is the reopening of schools, because kids are carriers of these viruses, and they're
Yeah.
carriers of like common cold. You know what I mean? And as for myself, I've got a child with an immunocompromised disorder, and going back into school, one of the major thing is there is nothing at the moment in place for her return in September. So what's in place is just like a general agenda that they've put out for all the children that are returning
Yeah.
to school. So I've got grave concerns at the moment for my child going back out to school. Then it's
Yeah.
going to be winter. Then the COVID-19 is going to probably the second wave. The virus might mutate. And also then you've got the common cold. It's also the flu season as well. So there's a lot of concerns that I have as a parent, and I'm quite sure a lot of people have those as well. But from my perspective, I am planning to meet with the head of here to have a formal discussion to see whether or not they've got a specific plan for my child and possibly other children that have been shielding
Okay.
as well from this virus. So I am quite concerned, and I am a healthcare professional with like 21 years experience, and I am very concerned.
So you're planning to have
So I
a
can just
meeting with the.
imagine what the public is like as well.
Yeah, absolutely. Phil?
You said you were planning to have a meeting with the head of your your child's school. Is that what you said?
Yes, I have to. I just have to because
I agree. Yeah.
we have been in shielding for the last 4 months. I was due to return to work last Monday.
Yeah.
The trust policy is for everyone that has been shielded, you should have a risk assessment. To this point,
Okay.
I have not had my risk assessment, so I haven't been able to go back to work. So these are concerns that I have, and I'll be presenting them now to the head of year because what sort of risk assessment have they done for my child to return to school in
Yeah,
September
yeah,
because
yeah.
she's
Makes
in
Yeah.
sense.
shielding and she has been shielding for the last 4 months, but they have sent me an agenda that is just it encompasses all the kids at the school. There's nothing specific for children that are shielding from the
Yeah.
Yeah,
disease, so I
yeah.
have
Okay.
got concerns. Yes.
Okay.
Yeah.
Shannon?
Just wanted to
Oh, sorry, Pauline,
come
go ahead.
back in with one thing that both Sophia and Alicia mentioned, and it's around the nutrition. We're very lucky in the West Indies.
Oh, yeah.
Eat your mangoes, eat your bananas, eat your akis, eat your plums, eat
Philip can
everything,
jump in just now.
right? Put down the ice cream,
Yes.
put down the ice cream, put down the sweet bread,
And he
put less
conquers.
cheese in the macaroni pie,
Sugar is
don't
the
add butter. No, seriously, this is a very, very valid point.
Sure.
The nutrition makes a fundamental difference because
Yeah.
if you are healthy when you are ill is a whole different thing than if you're unhealthy.
Yeah.
And get your vitamin. If you're in the temperate climates and you're not white, you probably need to be taking vitamin D. And
Okay.
vitamin D is
yeah,
very, very, very important for the immune system. I don't think we
and
realized
very
how
cheap.
important it was. And we thought it was vitamin C. Vitamin C was the big boy when it came to
I
immunity.
remember that. That's right.
And
Yes.
what
Yeah.
we discovered as darker people have lived in these temperate climates where there's not much sun, that lack of vitamin D can cause significant problems
Okay.
for people like us of color. So, go out and buy the vitamin D tablets. If you're living in a temperate country, you probably need it. If you're a white person and you wear lots of sunscreen, you probably need it as well.
Yeah.
Try not to get into the lockdown weight gain because it
Oh
actually
yeah.
doesn't help,
Yeah.
right? I mean, I know it's easy to say, but actually, as your weight goes up, your
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 risk goes up.
your risk of becoming sicker goes up with it, and it
Yeah.
doesn't go up in a straight line; it goes exponentially. So the nutrition thing is actually very, very, very important. And I know us Caribbean people, we're not good at eating properly. This is the time to do it. If you didn't like mangoes before, start to like them. If you didn't
I
like
love
banana
mangoes,
before,
by the
start
way.
to like it.
Yeah.
Everything you didn't like before, put down the pasta, go and eat some breadfruit.
I
Oh,
I
You
I
agree.
get
wish
the
I could
good
get some
stuff
breadfruit here.
in.
I was just going to ask the
That was a
question there,
really good
Pauline.
point
I
there.
know you
Well,
can't. I know you can't wait to jump in on the food film, man.
well, no, I was gonna say first though. Hold on, Phil. I was gonna say, well said, Pauline. I started to influence these men here by going
Please.
Here we go.
vegetarian.
Here we go.
So they've
Here we
jumped
go.
on now, and I started even before this whole thing. So y'all can thank me later on. They're not gonna want to thank me here.
Give him
now,
a
but
clap.
I thank myself.
I
Jump
will
in, Phil.
I will tell stories about you, Andre, and actually, I'm not even going there. I'm not even going to go there.
Lots
What the
of
Christmas
ginger
story,
and
man? The
garlic.
Christmas story.
I was just gonna say, I don't take vitamin D tablets. So what you're saying there, I might think of that. I've been looking more at foods that contain vitamin D. So I eat a lot of mushrooms, for example, and mushrooms are said to contain a lot of vitamin D. I also try to get into the sun whenever it peaks out in Manchester. I try to get outside, do a
I don't
little
think
bit
it
of.
peak out enough for us though. I think that's the thing.
That is true.
The problem, it doesn't actually peak out enough for us.
Yeah.
The minute you have a little bit of pigment, it's a battle, uphill battle,
So you
and
do
it's
think
easy
that
to take.
taking vitamin D tablets is an absolute?
And they're quite cheap as well.
Yeah, for
Yeah.
for us, people of
True.
color living in temperate climates specifically. I mean, I had the personal experience of it where I was having aches and pains and this and that and whatever and whatever. And when I did my vitamin D levels, it was in my boots. And when I took this vitamin D, it was like somebody had injected me with something you don't realize it until you've lost it. And it's not something that we are very well educated about. So thank you, Sophia and Alicia, for bringing it up. It's actually really, really important for us. And there's lots of research around critical illness and cancer and that sort of thing, and nutrition. And one of the big boys that has turned up is vitamin D.
Okay, I
Most
got
of
mine
us don't
tomorrow.
have
Okay.
enough, even if you're very pale.
And that is awesome. And I want to get let's roll on with the tips. So
Yeah,
Shannon,
Shannon.
and Stephanie will
And
come to
Steph.
you next. So
Yeah.
go ahead, Shannon. What's the tip that you want to leave for the audience as we look ahead?
I think I just echo everyone else. I think hand hygiene is so important. Wearing your mask appropriately is important. Making sure you cover your entire nose, chin, mouth. I find that I see people in the stores with gloves, masks, shopping, in their bags, pulling down their mask to eat, putting on lip gloss, digging in the bag with the same dirty gloves. So
Yeah.
just be aware and conscious of when you're wearing your gloves outside that you're not touching everything and
Yeah, yeah,
then
yeah.
infecting
Yeah.
yourself,
A
right?
lot of
Yeah,
cross contamination happening, huh?
The glove one is interesting because I saw someone wearing
Oh,
gloves
yeah.
standing in a queue to go into a shop. Phone rang in his pockets and he just reached in his pocket with the same glove on. And I was going, hang on.
with the glove
Yeah, I think you're doing it wrong there, buddy.
Yeah.
So that's very important.
And what about yourself,
Yeah.
Steph?
Well, I mean, I was going to echo that. Unfortunately, the general population, they don't really understand cross contamination. So you do see a lot of people out here with gloves, touching their touch screen phone and just putting it to their face.
Of course.
It just happens. But I, echo all the ladies here. Hand hygiene is very important. It's interesting to see that, we have advertisements telling you how to wash your hands. So I'm like, did nobody know how to wash their hands before this all happened? It's just, kind of odd, but hand hygiene is important. You know, if you can find hand sanitizer, grab
Yeah.
that, put it in your car, put it in your purse. I have a gallon of water in my car with a small bottle of soap to wash my hands when I leave the store. If you can, when you go into the grocery store, if you don't need a basket or a cart, don't use it. They don't really want you to come in with your reusable bags, but some stores are okay with it. Take your reusable bags, put your
Okay.
groceries in, load them, and bag them back yourself. You can try doing something like that. Vitamin D is also very important. Zinc is another thing that I usually take, vitamin C and zinc, cold and flu season. Adding in the vitamin D is also very important. So, like I said, I just echo what the ladies are saying, and I'm hoping, this flu season, school's opening back up, it'll be a good one, but I'm, just really unsure of what it's going to bring.
Yeah, that's going to be an interesting
Wow.
period.
Oh, that's awesome.
Interesting. Shayna, what about yourself?
I echo everything everybody has said.
Yeah.
All I would add is, I guess, if you're somebody who you've already found out that you have to work from home or something for the remainder of the year, because I know a lot of people have already gotten that directive. Make yourself a routine. I literally just did it because I find that I get stuck in not having a routine, and it makes being stuck at home even harder, and you don't get things done as effectively as you could. So I found that it was helpful for me to just make a routine, including an exercise routine, because as Pauline's pointed out, at first when quarantine started, I was doing absolutely nothing and starting to get some quarantine weight because I wasn't running as much as before. So I just made a routine and stuck exercising it, just doing YouTube videos or something like that. And it made a world of difference in my mental health and my productivity just moving forward. I just stick it on the wall and look at it every day, and crossing off a to-do list just makes me feel so empowered. I don't know what, it just does. So I think just adding, on top of everything everyone has said, just adding some semblance of routine to your life, and just putting in a little time every day for self-care. Even if it's just 20 minutes of exercise or 20 minutes of meditation or 20 minutes of calling home and hitting notification on the phone, just putting a little pocket of self-care that just makes the day and being away from people that you love and human interaction a little bit more bearable.
Wow. Look, I mean, guys, you got any other questions before I wrap it up?
No, I love that point there. I love that point that Shayna just mentioned about pockets of self-care. So valuable. And all the contributions have been so important. And I just want to say thank you so much.
Yeah, I mean, Phil?
No, nothing else from me. Yeah, the point on routine is something that I've given a lot of thought to. Not just a thought to. That's something that I stick to as well, and I support that.
Yeah, I'm probably
Let's
not
not
very.
forget adequate rest.
Oh yes.
Actually, yes, I meant because Donna Matthew was talking about that, and I know for
Yes,
sure rest is something that I struggle with a lot. Because once I have a idea, sometimes I keep working at it, but
that's
I
the thing.
find when I don't sleep is when I get sick.
Yeah.
You know, and
Yes, yeah, yeah.
Wow.
Look, I saying wow. I mean, I'm almost speechless at all the. First of all, to hear, what you guys have been through and are still
Yeah.
going through in many cases,
yeah,
whether it be on the front lines, but then dealing with personal issues yourself. Dealing with Sophie with your child who has immunodeficiencies, and then Pauline, you've lost close, you know, friends as well who work in this field, in the medical field as well. It's just been great. It's just been great to hear, what West Indian people. I mean, just so happened today, it's all ladies on the in the guest list today. But it's
yeah,
so great to hear what you guys have been doing, and we thank you so much for your service and what you guys are doing,
Yeah.
and for representing us as West Indian
Absolutely.
people across the world as well. So
Absolutely.
we really just want to thank you for that, and thank you for taking the time out for joining us today. Especially Steph. I know you came straight from a shift,
just
and,
out the
and you
shift in.
and you came on. So thank you for that. That's been great. And Shannon, I know you were on shift last night, and you still came out today. And thank you for that. So thank you everyone for that. So great having you. And for everyone who's been watching, I think collectively you need to give them an applause somehow. I don't know how you do it. Hit hearts, click
some love.
like,
Give some
send
love.
some clap emojis in the chat, something, because these ladies are doing a fantastic job.
Tremendous.
Not just in their own professions, but representing West Indians across the world. And and we're just thankful. We thank you for that. So throw up the hearts, or I don't even know how you do it in the chats. Tell them thank you, something, and we'll figure out how we get them in. There you go. Thank you for that. Thank you, Patricia. I think
Yeah.
a few people there, so I'm just gonna put Debbie Searle, shout out Shayna there as well.
Fan club.
Yeah, man.
Exactly. So no, but the ladies, you guys deserve it. So thank you so
Absolutely.
much, and thank you. Oh, we got plenty. Let me just share some of them here with you. We have some hearts coming up. We got that coming up there. We got Alicia Manson there as well. So thank you guys for joining us in the living room and for sharing your experiences. It's been great. So thanks a lot.
Thanks for the
Thank you
invite.
for having us.
No, thank you
Yes,
so
thanks for
much
coming
once
in.
again.
You.
Thank you.
Thank you. Thank you.
Thanks, guys.
There you go. Oh, that was a good conversation, James.
Loved it.
was,
Absolutely
yeah.
loved it.
That was really inspiring.
So, Mark, let me deal with this man now.
But one he introduced me
He
to
introduced us
healthy
to
eating
vegetables.
and all kind of junk. Well, man, what's your mouth, man?
I don't even know if Mark can spell mushrooms.
Almost let me step out the behavior properly. Mushrooms? You mean dumpy bar sauce?
I just
You used to speak.
I just say y'all don't need to be so personal. It took me a long time to get there, but
Man, look, enjoy your moment, man.
A
Enjoy
man
your
who
moment.
only used to eat carrot.
You know what I'm saying?
And lettuce.
I mean, I
And
know this
lettuce.
man for more than 40 years then. And the man has literally only started eating vegetables in the last year. And now he's a lecturer.
Exactly.
Let me tell you how to do this thing right. Oh, shit, man.
It's not where you start. It's not where you start, man, James. It's not where you start.
It's not where you start. All right.
Anyhow, listen, that was
yeah.
such an emotional but powerful conversation.
Yeah.
Listening to the experiences of what they've been through in their hospitals with their teams, the impact on the families, how they had to almost help families to cope. Man, I just found it
Yeah.
so impactful.
Yeah, I think
Yeah.
the points about personalizing the experience,
Yeah.
but then going back to it's all about community
Thanks, Pat.
connection. it's such a challenge, of from one perspective we have to personalize this experience, we have to make our own judgment calls, but
Yeah.
from the other perspective we can't do it alone. We need to
Yeah.
be connecting with others and having that wider community
I mean,
experience.
I gotta admit, until we were having this conversation, I probably didn't fully appreciate, what medical professionals were going through,
Yeah, boy.
having to juggle work and home, what
Yeah.
they were seeing at work, then still having to protect their loved ones. Everyone here was from the BME community, so then having that at the back of your head, as Pauline was saying, dealing with personal death in family, but then going to work and dealing with it again, but you can't take it to work. You've got to
Yeah.
just continue and just keep going.
Yeah.
I must admit, even though you know it's happening, but until you hear someone really verbalize it in the way how Pauline especially did,
Yeah.
you don't get to realize the impact it's having.
Yeah.
So it was really good to have that
And I think
conversation.
from her point of view as well, the point that she made, that it's just me and my husband. That is really insightful, but it's also a very strong statement, because where do you go? You're in a very close knit family, very very small, just the two of you off out there in the world. But you have to deal with these things at your own family level, and sometimes you've got nobody else to turn to. It's just the two of you, and that in itself can be very, very hard, man. I
Yeah.
mean, Phil, you would know that from living in various parts where it was just you and Nicole,
Nicole,
and
yeah.
it's hard. It's really, really
Yeah.
tough.
Yeah, at the beginning of lockdown, those first 3 weeks felt like almost a bit of a holiday, so to speak. It was okay. It's just going to be different. It's just going to be working from at home for a little
Yeah.
bit.
Yeah.
But then I remember when the stories of death started
Started
coming
to
in,
hit.
and
Yeah.
they started coming so close to home. It got to a point after those first 3 weeks that I always knew someone who lost someone,
Yeah.
right?
Yeah.
Through COVID
Yeah.
related death. And I think when it comes to dealing with death, that's when the conversations start to change, and that's when the mindset
Yeah.
start to change, and that's when hysteria starts to
Yeah.
rise. And I like the term that Pauline used of the loving meditation of getting to a
Yeah.
point of acceptance that this is what it is.
Yeah. Yeah. Yeah.
And I
And
think
there's a lot in that.
I think the fact too that we are still pushing a lot of that grief and pent up feeling down the road, because we're still trying to deal with grief, but still trying to understand the impacts of COVID, and still trying to deal with people who've lost their families. And all of that is just rolling forward and rolling forward. And we haven't really had a pause to really properly reflect on what's happening, how are we doing. You're just constantly in this bubble that's evolving all the time, and it's difficult.
Yeah, and just bringing it home to the Caribbean for a bit as well. It's not for us to underestimate how many West Indians are out there across the world in the medical profession, who's on the front line of this. In the Caribbean, obviously we see very limited cases, very limited numbers of death and what's not. It's tempting to think that we're all safe there, but so many of us are all over the world.
Yeah.
That this thing is still impacting the Caribbean. What we're seeing outside the Caribbean is still impacting the Caribbean in a big way. I think someone shared in the chat that they lost a friend, their daughter, and their husband, all in the space of 3 weeks.
Wow.
And those are West Indian people, where that's happened. So this is still impacting us in a huge way, despite our able to handle it within our borders really well. So that's why I thought this was a really important conversation for us to have today.
We need to have.
Awesome. Really appreciate it.
So it was really, really good. But guys who are still with us, thank you for staying with us throughout the entire 2 hours or so. As usual, I always say, join us on Twitter at WeGlobal, Facebook at WeGlobal Media, and YouTube and Instagram at WeGlobal. It'd be great to have you. Really join those areas and those networks as well, because we have these conversations all the time. There'll be more different types of conversations coming as well. But really join, be part of it, be the first to be in the know. You can get the notifications and what's not. It'd be great if you guys can join us on this journey as we carry on. So, we just want to say thank you all for joining us. It's been great, a fantastic conversation today. And we just hope you can join us again next week.
I see you had another framework there today, Phil. Family, team,
Frameworks,
community,
man.
and connections.
Important, man.